Hi, and welcome to the AACP Australia. We are in the final stages of putting together the plans for our global summit on non-CPAP therapies for obstructive sleep apnea. And it's my pleasure to introduce us to Dr. Karen McCloy, who will be giving our third lecture on Wednesday next week. Hi, Karen.
Hi, Charlotte.
For those of you who might be watching this still on the Facebook page, can I please encourage you to go to our website and register for the event at www.aacfp.com.au. The event is run inside a Facebook group, and in order to receive notifications about how to join us, you do need to register for the event. If you have already registered, please check your spam, check your email, and make sure that you have followed the instructions to be able to join the group. Karen is one of our education officers, and therefore we actually have two education officers at the AACP Australia. We consider it a very important position. So I'm going to ask you first, Karen, if you don't mind, what do you think it is about the AACP Australia's education that really makes it a world-class event?
Oh, well, there's lots of things, but I think the main thing is that we really take a big overall global look at the problem of chronic pain and sleep disorders. So we're global because we consider not just dentists, but all of the allied therapies that help us, because we understand that getting these patients of ours better requires teamwork. And so our topics and our symposia reach out to the whole team, and we cover topics that are relevant to the whole team, because that's what's needed to really treat these people.
Fantastic. So people are engaging with us next week from Monday to Saturday, and this is really purely on sleep, but I guess I want to get across to people that we are very much in the field of craniofacial pain as well.
Mm-hmm. Absolutely. And, sleep disorders are well, for TMD, the OPERA study said they were causative for first onset TMD. So you really can't talk about one without the other, really.
Yeah, perfect. Thank you for that. And it's also really important that we build a community. So if this is your first interaction with the AACP Australia, we really are, I believe, very, very good at supporting our practitioners, whether you're a dentist, a sleep physician, or an allied health therapist. We are very much inclusive of what all of you do, and we're interested in building understanding between all these different people within our groups and supporting you with education that you can take back to your practice and start to employ from the day after you get home again. These days, of course, you don't have to travel, so it's even easier. So Karen, next week, your talk is on Wednesday, and it's on reading PSGs. But first of all, tell us a little bit about who you are and where you will be presenting from next week, and what makes you the person qualified to talk on this subject.
Thanks, Charlotte.
You're welcome.
I'm a general dentist, as we all are that are giving these talks. I have a general practice, and you can see my room, my home behind me. And the reason that I'm here on a Sunday afternoon is because I actually live at the Glasshouse Mountains in Queensland, and I live between a couple of the Glasshouse Mountains, which is basically a black hole. So I really don't get, apparently, according to the committee, I sound like I'm talking under the water in a bathtub if I'm not here online. So that's why I'm here. It's not that I really love coming to work every day, but I do love talking about facial pain and sleep. And so because of that, I've done a couple of extra courses, a couple of master's things on facial pain and sleep. And it's a very important part of my practice. That's why you're talking to me.
Yeah. And Karen is greatly underscoring those couple of extra courses. So your topic next week, Karen, is on reading PSGs. And this one isn't often covered. Everybody gets very much into the diagnostics, they get into the appliances, but not always do we cover reading PSG. So why is this an important part of our global summit next week?
Well, anyone who treats patients knows that it's a great day if your patient is happy, regardless of whether you're looking at this as a dentist or a physiotherapist or a chiropractor or whatever. You want your patient to be happy. And so that means that you want to have the best chance of whatever therapy you're offering working for that patient. And I think that as a group, although as dentists we can't actually, discuss the diagnosis that the patient's been given, There is so much information on that document that we can use to help us to decide if we should treat the patient, if we require help treating the patient, if they need adjunct therapy, and what degree of success we should tell the patient to expect, and really how much we should warn them about the lack of success they're likely to have.
Fantastic. Really, really important points. It's so much more than just an AHI, isn't it?
Oh, absolutely.
Yeah. So Karen's going to really drill down on how to get the detailed information out of a sleep study that you might not even recognize is there. And that's going to help you, as she said, in diagnosing and managing your patient, also setting expectation and delivering more predictable outcomes, both for you and for the patient. Happy patient, happy day. What can people expect to learn aside from how to scan some of those details within the PSG?
Well, you know, the PSG covers pretty much everything that we know about sleep. So pretty much life, the universe, and everything about sleep. So we'll just take the PSG form that we get and we'll just go through it page by page, and we'll just see what kind of little pearls we can get off of every page that might help us to understand that patient, why they're there and how they got to be there, and what they have to do to get away from us, basically.
Brilliant. Thank you, Karen. Really appreciate the time that you've spent with us this evening explaining that. I think people are going to get very excited about the content of your talk. I'm sorry that you all have to wait until Wednesday. You'll just have to keep that excitement going. But we are really thrilled to bring you this course over the next week. It starts tomorrow, Monday, 7:30 p.m. Australian Eastern Summer Time, and will continue until Saturday of next week. As I mentioned, if you're watching this on our Facebook page and you haven't yet registered, please visit the website www.aacfp.com.au to be able to register. If you have registered, please make sure that you are following the notifications. The event will only be happening inside the Facebook group. Thank you, everybody. We're looking forward to bringing you this, and here's for rush to tomorrow and set alarms, set reminders, make sure you don't miss a minute of this brilliant, free and mind-bending global summit. Thanks for now. Thank you, Karen.
Thank you. Bye, everyone.
Bye.